how do I save myself from getting cancer. As far as breast cancer cases are concerned, the affected age group was 50-60. Now it has come down to even 30-40. Are there any specific reasons for it? First time when you tell someone that you got a cancer, it's like breaking a big news to someone. Namaskar Yokar Tumka. We have with us a doctor who's a specialist in the cancer surgery, is a specialist in cancer care, and when we speak about cancer and increasing cases of cancer, we thought of meeting him and trying to know the basic information about cancer. We have Dr. Shailesh Shrikhande. Doctor, you are Deputy Director with Tata Memorial Hospital and in charge of cancer surgery unit. We'll start straight away. Is it that number of cases are really increasing as far as cancer is concerned, or number of detections are increasing?
No, I think there is a real increase in the number of cancer cases. There is also increased detection. Increased detection happens because of more awareness and more diagnostic facilities available as India continues to develop as a country everywhere. But beyond awareness and diagnostics, we also have a lot of problems in terms of environment, in terms of multiple causes which makes cancer truly increase in number. This is a worldwide phenomenon, but it is also very strongly seen in the Indian subcontinent.
So now, a basic question: people want to know, how do I save myself from getting cancer?
So people always want to know, but I think the best thing is if you lead a life of moderation, you will not get cancer by and large. Cancer is an uncommon event. It gets reported, and when you get a cancer in the family and when you read it, or if you go to a hospital, you start thinking that everybody gets cancer. But actually cancer is an uncommon event. The human body is beautifully designed to resist the development of cancer. But when you do unnatural things, or when you do things which are in excess and not in moderation, then you start getting cancer. I will explain this. Cancer is mainly an environmental and a lifestyle problem. It is less of a hereditary or a genetic problem. Less than 10% of cancers are due to hereditary or genes. 90% of them are environmental causes. What are the causes of environment? Let's look at a simple case of diabetes. India has become the diabetes capital of the world, and diabetes is related directly to poor diet and lack of exercise and overweight. So when you ask me what can be done to prevent cancer, if you are not overweight, if you exercise regularly, if you don't eat all the wrong foods all the time, the chance that you will get a cancer is much less, much less. Similarly, smoking, also tobacco. 33% of the cancers of the oral cavity and the upper aerodigestive tract, as we call it, cancers of the throat and head and neck and mouth, they are all related to tobacco, and tobacco in different forms. It can be pan, it can be zarda, it can be you put tobacco in your cheek, different forms of tobacco. Cigarette also. So 33% of the world's head and neck cancers are located only in India. America has only 2% of the world's head and neck cancers. That means we need to do something about our tobacco consumption and our tobacco industry, and the fact that people get addicted to a powerful, addictive, carcinogenic substance like tobacco. So diabetes, tobacco, overweight, poor lifestyle, and lastly I would say fast foods. When I say fast foods, I don't point a finger at a particular fast food. I too enjoy a fast food. You will also enjoy, and we all should. When we start overdoing it, that's when the problem comes in. So if you are going to be having a diet which is low in vegetables, a diet which is the vegetables are not clean, or they are treated by chemicals, or they are artificially grown, or the water that you drink or consume is not clean water, or you take too much of meat in your diet, red meat specifically. When you start doing these things, you again increase the risk of getting cancer. So these are the things: diet, smoking, tobacco, diabetes, overweight, lack of exercise, pollution in the air, bad quality water. If we can take care of these broad 7 or 8 things, the incidence of cancer is much lower than what we think it is.
Earlier, this was considered as only urban area disease. Now we have seen even in rural area, you get a lot of cancer cases.
Correct. The reason is two. One is that even our rural areas are developing, and secondly, you also have a lot of population which is moving to the urban areas. So what was a rural area 20 years ago for me is today no more a rural area. It is a well developed area. So you have tier 1 and tier 2 and tier 3 cities, but tier 3 cities are like any other city also. As a result of which, urbanization and lifestyle is contributing to the development of cancer.
We have seen places like Goa, intestinal cancers are more as far as Goa is concerned.
Yes, yes.
While cervical, I may be wrong in saying,
Cervical cancer.
cervical cancers are very less compared to the national average.
Yeah.
Are there any specific reasons that you see a specific trend in the entire state?
So I can definitely know that here the diet that we have in Goa, and I don't say revolving around fish, we all eat fish, even I love fish, and amongst the meats it is perhaps the best meat to digest. But red meat, a diet low in vegetables and a diet high in fats and carbohydrates and red meat can definitely contribute to the development of intestinal cancer. So we ideally need to undertake a study in the region of Goa by doing a good epidemiological study, by trying to understand the food habits and the lifestyle of people, to understand why we get colorectal cancer more and more in Goa. But we also see a lot of colorectal cancer in all urban cities of India now than what I saw 10 years ago and what I saw 20 years ago. So the number of colorectal cancers, the number of digestive cancers, they are all increasing, and they are all related to lifestyle and diet.
Doctor, we have seen earlier as far as breast cancer cases are concerned, the affected age group was 50-60. Now it has come down to even 30-40. Are there any specific reasons for that?
Well, again, it's very difficult to specifically say specific to breast cancer, but the fact is that again, you have an issue of lifestyle, you have an issue of better diagnostics, you have an issue of being able to diagnose tumors with breast cancer screening by investigations such as mammography. So generally speaking, you are getting cancers detected early. So cancers in the young, not just breast cancer, but also cancers in other parts, intestinal cancer, pancreatic cancer. We do see a large number of them in the age of 40s as well. Now, India's life expectancy has gone up from 64 to 69. So previously we used to always see the patients in the age group of 52 to 62 getting a cancer. But now our life expectancy is increasing, and even then, now the life expectancy, if a child survives the first 5 years of life, life expectancy is 75 years. So people like you and me, as an average Indian, should live at least for 75 years. But you get younger people. Some of the causes we do not know. For example, rectal cancer developing in young Indians, I do not know exactly the reasons. But urbanization, lifestyle, perhaps lack of lactation or late breastfeeding or absence of breastfeeding due to lifestyle could also be contributing to the development of cancer in younger women.
But
it's a multifactorial etiology.
how do we justify that in certain kind of cancer is seen in certain states predominantly, because people have different lifestyles. I might have a similar lifestyle that of someone in Mumbai,
Correct.
but I am also bracketed in that, you know.
Yeah, because the essential aspects of lifestyle apply all over the country, whether you are in Goa or whether you are in Mumbai. Now, beyond that, specific to a particular community, if there is a trait of a particular cancer, we need to study it more. Like we clearly know that stomach cancer, due to certain specific foods and lifestyles, is more prevalent in Kashmir and in Tamil Nadu. It is less prevalent in Western India. It is more prevalent in northeastern India, Kashmir and Tamil Nadu. But this is based on good epidemiological studies. Do we have good cohort studies and good epidemiological studies across India? We don't have enough. And do we have many from Goa which is able to elucidate as to why a particular community is getting a cancer which is specific to them? We don't have those studies. So what you are telling me is more of a subjective impression, but we don't have high quality data for that.
Goa, we have a case of a place called Kankona. We have kidney related cases which are coming up. So,
Kidney cancer, you mean?
These are kidney failure cases.
Yeah, yeah. So again, kidney failure and people getting chronic kidney disease early could well mean that there has been some toxicity of some kind. We would not know this.
Water?
It can be water, but I would not know. Again, I am an evidence based person. I would really not know as to what is the precise cause. We know that steroids can do, drugs can do, random utilization of painkillers. Most of the painkillers are toxic to the kidney, but people many a times randomly take painkillers by going to the chemist. There is some pain, this pain, that pain, and they keep on taking medicines, and they can be nephrotoxic drugs. So a whole number of drugs have to be used very carefully. See, every drug is a wonder drug, but it is also a poison. So we need those drugs for treatment, but the side effects of these drugs can also be responsible for kidney damage. Now, specific to the area that you are talking about, it could be the quality of the water. Hard water, for example, also in the state of Maharashtra, in Marathwada, etc., the water is very hard, the weather is extremely hot, and the chances of people developing urinary stones and kidney stones and bladder stones is very high, because water is hard in that area even now. So earlier, 25-30 years ago, when I was training to be a surgeon, we used to see kidney stone disease much more. But now, as water has got better and better everywhere, we do not see kidney stone disease as much. Similarly, you spoke about cervical cancer. As the availability of water, as the concept of hygiene, and as the concept of vaccination improves, we will have less and less cervical cancer in the country. It's seen more commonly in uneducated societies, in poor countries, and India is a low middle income country, but we are also improving. So as we start becoming more educated and more financially secure, and also implement vaccination, cervical cancer is a cancer that even at Tata Memorial we have seen that the numbers of cervical cancer are coming down, and this is good news.
Okay, last two aspects I wanted to. I as a cancer surgeon or a cancer, first time when you tell someone that you got a cancer,
Yeah.
it's like breaking a big news to someone.
Yes.
It might be a general, usual thing for you.
Yes.
But how do you manage to tell a person? And
See,
what
I
are the
think-
words actually? How do you tell them?
So I think you have to tailor what you tell and how you tell them by understanding the psychology of the person, also to see what is their support system along with them. Fortunately, in our country, we are becoming more and more with nuclear families, but we usually have a good family network of family and relatives and friends. They are a big support for the person who is affected by cancer. So whenever I see a patient in my consulting room, I first assess their level of education. How are they psychologically? Are they likely to be stronger or weaker? Do they have a support system in terms of somebody who is very close to them and with them, or are they alone in this world? There are most people who actually want to know the truth, and you have to break the news as honestly, as softly, and yet as clearly as possible. So those who are willing to handle it, I prefer to tell them the truth and the whole truth. There is no point in giving them a false hope. But there is a small group of people who perhaps are in so much of denial and so much of fear, they don't want to hear. Now, this is not possible if you are practicing abroad. I've been abroad for about 3 years, where the only communication is between the doctor and the patient. In India, we have a structure where we can tell part of the truth to the patient, not the whole truth, but do tell the whole truth to the wife, husband, children, parents, brother, sister, immediate, near and dear relatives who stay. So, on one hand, you speak the truth to the near and dear ones, and to the patient, you don't speak a lie, but you give only half the truth, and then you gradually break the news. So, some people want to know everything the first time they meet you. There are some people who gradually, in 2 or 3 meetings, understand what the problem is. So, I think you have to be a first good human being to understand that people have come to you because they are in difficulties, and they have reached you because they are in need. The minute you understand that it is not a routine job for me, every single patient, every single day, though I am doing this for more than 2.5 decades, it's a very difficult job to discuss the news of cancer. First, handle the shock, the denial, and then give them the support and give them cutting edge treatment to give them a chance to get cured or to live long, and while doing this always maintain a good quality of life. So it's a big job that we do beyond the surgery that I do, which is of course very complex.
So you have a tie-up with Goa government right now.
Yeah, so the Goa government approached me last year, Mr. the Chief Minister, as well as Mr. Vishwajit Rane and Mr. Sawant. They were very keen that we should do something to support cancer care with Goa Medical College. So we did ink an MOU last year, where I had come here to Raj Bhavan, and we did say that we will be able to offer some consistent hand holding and consultations. We have some doctors here who are already trained in surgical oncology, in medical oncology and other specialties. So they also need some hand holding so that consistent cancer care for the people of Goa can happen right here in Goa itself. So yes, there is a tie-up where we will try to be consulting from there, with some doctors periodically coming here to help in complex cases, discussions, management, etc.
There is, you go to any hospital which treats cancer, there is a Tata Memorial expertise there. Like those people have worked with Tata
Yeah.
Memorial, they are always there. You find them in Manipal, maybe
Yeah.
in GMC.
Yeah.
So why do actually Tata Memorial has to come all the way when you have already your resources working?
So you are absolutely right, but you know what? Um, the requirements of surgical oncologists, medical oncologists, radiation oncologists in this country is so much, and you're going to require so much more in the next 2 decades, that the ratio of doctors to patients, or the ratio of specialists, cancer specialists to patients, is a very bad one even now. Now we train about 50 to 55% of the skilled people from Tata who go all over the country. But still, an individual is able to do and treat a certain number of patients around him or her, their practice and their team. But when institutions tie up, it happens at a policy level where you are able to implement and act simultaneously. It's not just about supplying a trained doctor to that place. It's about the whole philosophy of managing cancer care, from preventive oncology to palliative care at the other end of the spectrum, undertaking epidemiological studies. So all this requires institutions coming together, and that's why usually institutions approach us that we need you to handhold us. They don't say that please train more doctors for us. They do, but we have limits to what we can do in terms of training. If we overtrain too many doctors, we are going to compromise the quality of their training. That also should not be done. So to be a doctor, it takes years, if not a decade, and then to be a trained specialist, it perhaps takes a decade and a half before you are really qualified enough to do some things, because it's not easy. So a few individuals are there in Goa, but you require much more to fight the problem of cancer.
Last question, because I know you are in a hurry to rush.
Oh, I'm totally fine.
We have seen that there is uneven distribution of cancer treatment or cancer care as far as India is concerned.
Yeah.
We talk about Goa. We have GMC which is treating cancer just 2 kilometers away is Manipal. This side there is Healthway. And now if we cross the boundary, then the next cancer thing may come in Ratnagiri or maybe somewhere in Mumbai.
Yeah.
How do you bridge this entire gap?
So this is always a struggle. It's not easy to bridge. India is a unique country. We are still a young country, and we are also a country which lives in different centuries at the same time. So when you have still a large number of people who are illiterate, you still have communication and connectivity problems, and you have a big, large population to cater to. Inequalities are there in every aspect in this country, and that inequality is also there in the medical fraternity. Now, in order to have good doctors who are also going to work in the most remotest part, the doctors also need a place to work in terms of infrastructure, and after infrastructure comes the culture that the place develops for the local population to get the trust and faith in that place. This is a long process. And the next thing is, the doctors would go to a remote place to work if their standard of living and their children have a chance to go to a good school. So if today I realize that my children can't go to a good school, my wife can't get a job, my parents are staying in the city, and if I require health problems, I myself have to run to a city, the chance that you will get highly educated people working in a remote place is difficult. So unless and until places develop and unless and until society develops in a structured way, healthcare will continue to be inconsistent. But by the way, the same is applicable even in the United States of America. So you get huge amount of inequalities about access to care. And incidentally, I wrote an editorial, an invited editorial in Times of India last year, that the three key things are availability, accessibility and affordability. When you start factoring all these three things together, you realize that any minute, the moment you are in an urban place, you will get more facilities for everything: schools, markets, shopping, variety, healthcare, hospitals, doctors, specialty, everything you will get. So the places develop. So this happens across. So you will always find that in the cities a lot of care is available far more easily, but in the villages the care is not easily available. So the answer to this problem is to try and have a system where the local population starts to trust the primary healthcare center. So it's not that this system has not been created by the Ministry of Health. There is the primary health center, there is the urban healthcare center, there are district hospitals, there are state level government hospitals, there are referral hospitals. So the structure of taking the patient from the village right to the tertiary care, the physical structures are there. But now how to make sure that those physical structures are attractive for doctors, how to make sure that you generate enough employment, how to make sure that the doctors are working in a nice good environment so that they will teach more and inspire the next generation of doctors to come there, and how will they practice their medicine for the local people to come to them first. So actually that is the primary filter. is the primary health care. Now what has happened is, because these systems have not delivered very well consistently, the private enterprise has come in. So the private enterprise has come in to fill in a gap which is obviously there, as you said. So now you have a large number of private hospitals coming in. But even the private hospitals, large number of them will concentrate on the urban areas or the semi-urban areas. So the inequalities will remain as long as India remains a low and a middle income country. And even after we become a middle income country, the inequality will become less, but it will still be there. But am I negative? Not at all. In the 1980s, if somebody required a cardiac bypass surgery, either you had a lot of money to go to England or America to get your bypass done, or maybe one or two centers in Calcutta, Delhi, Bombay would do. Today, if you require bypass surgery, it is done in Goa, it is done in Miraj, it is done in Sangli, it is done in Solapur, it is done in Latur, it is done in Belgaum, as well as it was done in America 20 years ago, 30 years ago. So do I see a lot of progress in this country? Amazing progress. And do I feel that the next 20 years, the future belongs to India, not just as a healthcare professional, but even otherwise? I do believe.
Thank you very much, Doctor.
Thank you so much.
Thank you for giving your time, valuable time.
Pleasure.
Yeah.
Thank you so much.
तर हे आशिल्ले डॉक्टर श्रीखंडे. हे ऐकून जर कांय जाणांनी सुद्धा सम चेंजीस इन युअर लायफस्टायल इफ यू डू अँड इफ वी कॅन सेव सम decrease some percentage of cancer cases, then I think this is the success of this interview. You're watching this interview on your favorite website www.goanewshub.com. Keep watching us.